Remember to subscribe and don't forget to hit the bell icon to never miss an update from First Cry Parenting.
Home pregnancy tests. What, where, when, and how? A home pregnancy test is a convenient option to determine if you are pregnant or not. If this is your first time, here's what you need to know. Home pregnancy tests are designed to detect the presence of human chorionic gonadotrophin, HCG, also known as the pregnancy hormone, in your urine. As soon as you get pregnant, your body starts producing HCG once the fertilized egg implants in your uterus. About pregnancy test kits. While buying a home pregnancy test, make sure you keep the following things in mind. 1. Check the packaging and ensure the pack is intact before buying the test kit. 2. Check the expiry date, as an expired test may not give accurate results. 3. Look for pregnancy kits that come with 2 sticks. If you take an early pregnancy test, and the results come out negative, you can take the test again after certain days to confirm the result. How to take a pregnancy test at home. First of all, read the instructions on the pregnancy kit carefully about how to confirm pregnancy at home, as it may vary from kit to kit. There are different ways to check your pregnancy with different types of kits available in the market. 1. You can simply check by passing urine on a test stick. 2. In some tests, you may have to collect the urine in a small cup and then insert the testing strip into that cup to confirm pregnancy. 3. Some kits may also provide a dropper for placing the urine sample on the testing stick. Some tests show pink or blue lines on the test strip, others show plus or minus signs, and some digital ones show pregnant or non-pregnant words. When to take a home pregnancy test. 1. If you have missed your period, consider taking a test if it has been a month since you had your last period. 2. If you are having cramps. Implantation of an egg in your uterus also causes stomach cramps similar to menstrual periods. You might feel your periods are incoming, but they don't. 3. If you have sore breasts, excess production of estrogen and progesterone in your body can make your breasts sore, tender, and fuller when you get pregnant. 4. In case your contraception failed, contraceptives like condoms, birth control pills, etc., do not give 100% protection and can fail. 5. If you are feeling different, nausea, food aversions, exhaustion, and frequent urination are also some signs of pregnancy. When should you use the home pregnancy kit? Most tests recommend using the first urine in the day for taking the test since HCG levels will become concentrated in the urine through the night. But you can take the test at any time of the day, irrespective of the test you are using. But avoid drinking too much water before taking the test, as it may dilute HCG levels in the body. How accurate are home pregnancy tests? The home pregnancy test kit usually provides 99.99% accurate results if the test instructions are followed correctly. In some cases, a home pregnancy test may be a false negative. So, if you suspect that you are pregnant, go ahead and take the next pregnancy test.